The Tribal Health and Human Services Department of the Confederated Salish and Kootenai Tribes is proud to present Good Medicine, a program dedicated to the wellness of the Flathead Nation. The mission is summarized quite simply: a healthier people, a stronger nation. We will strive to make Good Medicine a reliable source of ideas and information about health issues so that everyone can make informed decisions about their own lifestyle and health care. You will meet health professionals, tribal government and spiritual leaders, and interesting people from the tribal community discussing important health issues that profoundly affect us all.
Hello, this is Good Medicine. I'm your host, Larry Pitts. Today I have Dr. Chris Buzan. He's a doctor of chiropractic medicine. And Chris, welcome aboard.
Thank you, Larry.
Is there anybody you'd like to say hello to?
Well, Mom, hi. Mom, my cat, Weezer, hello. My wife, Marianne, hello.
All right. That's good, Chris. Chris, you know, we've been doing this program now since late December, and we've been touching a lot of traditional medicines, and we thought it was about time to bring in a little bit of the other world maybe and see how this ties in together. And so you were our first contact. And so, Chris, how long have you been a chiropractor?
I've been a chiropractor for 16 years.
Okay. You want to take a minute here and just try to tell me what chiropractors are today and what they aren't?
Yeah. Well, chiropractic's about 100 years old in the modern era.
Mm-hmm.
It goes back probably to the Egyptians. It goes way, way back. Manipulation's an old tool, and we kind of forgot about it during the Middle Ages, and then it was sort of rediscovered by this guy in the late 1890s. And now we have about 16 schools around the United States. We are licensed in all 50 states. Medicare pays for our services. Almost every insurance company covers us. Workers' comp in all 50 states pay for our services. So we've come quite a ways in terms of recognition and people understanding what we do. We're really the musculoskeletal specialists, essentially. Mm-hmm. Although the early chiropractors got fascinated with this stuff because they found that they could impact the internal organs of the body as well in some cases. And I've seen this myself. I've had a couple cases of tachycardia, which is real rapid heartbeat. Okay. And people will come in and they'll tell me, this is the only thing that slows my heart down. Mm-hmm. So I check them out and I adjust their upper back, which is where the nerve that goes to the heart comes from. And sure enough, in the time it takes me to walk around and check their pulse, their pulse rate may have dropped by 50 beats a minute. Wow. So it can be very powerful. I've seen it work for dysmenorrhea, which is painful menstrual cramps. I've seen it work in some cases of asthma, believe it or not. Mm-hmm. So it can have a lot of wide-ranging effects around the body. Okay. Now, what isn't chiropractic? Well, we're not medicine, okay? We don't prescribe medications or drugs. We're a drugless profession. Mm-hmm. We work mostly through the body in a natural way using manipulation, massage, nutrition, to make changes in the body that way rather than assaulting it with a real strong drug, which we're not really against drugs, by the way, because we think there are times when drugs are very appropriate. Yeah, for me, especially. Absolutely. And there's times when, frankly, I wish I had the ability to prescribe an anti-inflammatory or maybe a muscle relaxant to help somebody get through that acute phase of their injury until you can get in there and start working with them. Right. But that's just not in our philosophy right now, and it may change over time, but actually, as I was the president of the Board of Chiropractors until about 2 years ago, and I did try to see if the profession in this state wanted a law like that to allow us limited pharmaceuticals. And for most of the people in the state said no. Most of the practitioners were against this. So we're willing to jump into that pool. That's right. They think there's enough of that already, and that what we really need are more people that are doing natural type of medicine. Okay. So that's what we're doing. Okay. Now I understand you have a practice in Missoula, and I know you're now at the Medicine Tree. You want to talk about that just a little bit? Yeah, I've been in Missoula about 16 years, and I've always really been attracted to the idea of an integrated type of medical facility where you have different types of doctors working for the betterment of the patient. I can remember about 4 of us who work at the Medicine Tree now sat around in a little house in a living room about 15 years ago in Missoula talking about this very thing. Boy, wouldn't it be nice if we had this building and this facility and so on. Well, we didn't know about Mary. And Mary Stranahan came along, and she had the wherewithal to put this thing together. And now we've really got this building and this facility. And so that's why about a year ago I expressed interest in coming up to work 2 days a week at the Medicine Tree, because they're doing what we've all thought would be the perfect kind of healthcare facility. They're doing it up there now.
Now, what is that model of perfect healthcare?
Well, I don't know if there's anything called perfect healthcare, but it's certainly it seems logical to me that if you have different types of choices that you can make in the pursuit of your health, you're going to be better off than just going to one type of practitioner who has only one viewpoint or one way of dealing with things. At the Medicine Tree, if I'm having problems, I had a gal today. She was having a shoulder problem. I'm treating it. It's getting better, but it's not where I want it to be. I went over and talked to one of the docs, and he gave her a script for an anti-inflammatory, just like that. She didn't have to spend the money to go see him to get the script or get the exam. Because we work together, he trusts my judgment. He knew that this is probably appropriate, and he went ahead and ordered it for her. So there's little things like that that can streamline patient treatment. It can make it more cost effective because they don't have to go out and pay another exam fee or another office visit fee.
All right. Well, and putting it all under the same roof, then you're as you said, you're in-housing everything.
Yeah, pretty much. We do use some outsources. We do use there's a radiologist that we use to read some of our X-rays, but a lot of the stuff that we do, we can do right in-house.
Now, what about spinal manipulations? I mean, how does that affect somebody?
Well, the whole theory in chiropractic, and this is really what chiropractic's based on, is the fact that you have 24 movable vertebrae in your spine.
And hopefully they're movable.
And hopefully they're movable, because it's when they don't move that things start to go wrong.
Right.
And there are 31 pairs of nerves that come out throughout the spine, and they go to all the organs and tissues of the body. And they go to the heart, the lungs, the liver, the kidneys, the spleen, everything, as well as all the muscles and joints. So when one of those vertebrae gets stuck or tight or locked up, it irritates the nerve that comes out of the spinal cord between two vertebrae. And that nerve gets, it may not function quite right. You may get numbness in your arm, for example, or tingling, or maybe weakness. And that's a sign that there's nerve irritation. And what the chiropractor does is feel around in your back and see if there's any joint or vertebra that's locked up or stuck, and then he or she will find that and they'll make an adjustment. They'll slightly move it a little bit, and that takes pressure off the nerve, and it restores normal function to that organ or that tissue or that muscle that the nerve goes to.
Right. So in essence, the vertebrae really isn't out of place. I mean, you hear people go to the bone cruncher, this kind of stuff.
Yeah, that's a real common misconception, and I even hear other chiropractors use this language simply because this is what people call it, and they understand it, but bones don't go out of place. They get stuck. If I was to take an x-ray of your neck, for example, and let's say you had a lot of neck pain, and we saw it as it was with pain, and then I came along and adjusted your neck, and we took another x-ray right away, it wouldn't look any different. We're not really moving it from here over to here. We're restoring motion to a joint that's stuck. It's sort of like a jammed finger. Somebody comes along and jerks on your finger. And
it wasn't out of place.
It wasn't out of place, but it separated those finger bones just enough to take pressure off that joint and relieve the swelling and the inflammation.
What was the noise?
Well, the noise, and that's very controversial, by the way. We think it's gas bubbles that are breaking inside the joint as we separate it. Some people think it's nitrogen gas, some people think it's carbon dioxide, but that's where we're at with it.
It's a gas.
It's a gas.
All right.
And it is a gas.
We can live with that, I think. What about chiropractic compared to traditional medicine? Are they starting to come more together? Are they years apart?
Well, for a long time, we were years apart. Medical practitioners in the 1960s and early 70s were actually told by the AMA not only not to send people to a chiropractor for treatment, they weren't even allowed to socialize with chiropractors. It was against their code of ethics. So we've come a long way since then. In 1976, several chiropractors in Chicago District Court sued the AMA, the American Hospital Association, the College of Radiology, anesthesiology, the College of Surgeons, about 16 co-defendants. And it took 11 years to go through this lawsuit, but eventually the chiropractors won. And we proved in court that these groups conspired to destroy and try to eliminate the profession of chiropractic. They have since changed their tune on this now, and there's a lot more cooperation between the professions. It's still not what I'd like to see it, but I think people are coming around a bit on this now. So,
well, I think there's been a huge, change of mindset anyway in the traditional medical field.
Yes.
They're starting to look at other alternative ways,
well, people, I think, they just want answers. They want to get better. And they don't deify medical physicians like they used to. When I was a kid, a doctor was a guy that was up on a pedestal. I mean, whatever he or she said went, and that's the way it was. I don't think we think of these people the same way anymore. The general public doesn't tend to sort of worship them like they used to. And that's a very good thing, because yes, they're wonderful people and they know an awful lot, but no one person can be all things to all people. And so this is the beauty of some place like the Medicine Tree, is that we have all these different disciplines under one roof, and the people that work in that facility are much more open-minded about other people's practice than I think they probably normally would be in the real world out there. So that's been real beneficial.
Well, I recently flew out to Seattle for some stuff, and while I was out there happened to be a chiropractor who was advertising, and he had this huge list of all the things that he could cure. Now, is that dangerous in your opinion?
I think that's real dangerous. I would never tell anybody I can cure anything. I think the body cures everything. The body has this innate healing ability to cure itself and heal itself. And all we do as practitioners is simply do something to help the body heal itself. We just assist it. That's exactly right, Larry.
Okay. That's it's exciting to me to see that things are starting to change in that way, that we are giving people choice. Now, when you talk about doing chiropractic, how do you evaluate somebody that comes into to see you as a chiropractor? Yeah.
Well, if you were to see me do a workup on a patient, say that somebody came in with lower back pain, I think my exam would be very, very similar to what a medical doctor's exam would be. We all start with range of motion. We see what the patient can do in terms of bending and twisting their body. We'll check reflexes, where they tap you on the knee with the hammer to see if those nerves are working. And we'll check muscle strength in the legs. And then the difference, I think, would be that what I'll do next is I'll go to feel the spine. I actually push on it. I'm prodding along in there. I'm looking for things. I'm feeling. I've developed my sense of touch, and all chiropractors have to do this, so that we're very aware of little subtle changes within the architecture of the spine just by feeling it. And I may or may not take an x-ray. It really depends on the history of the patient. The x-ray generally doesn't tell you where to adjust people, but it'll tell you that there's pathology maybe in the area. Maybe you have a tumor, maybe you have a fracture, maybe you have a real disc that's narrowed between the vertebra. Maybe it's completely normal. We don't really know until we take a picture. So it depends on the history. If there's a history of a trauma, a car accident, something like that, I usually want to get an x-ray. If it's the guy's working in his garden, bend over to pick up a carrot and he hurt his back, well, an x-ray probably isn't going to show me all that much. So we don't usually do it for those things.
Yeah, in that situation, the carrot broke the camel's back, right?
That's it.
All right. How do you know when somebody needs chiropractic?
Well, again, that's kind of a judgment call, but I think as an individual, if I was a person in the viewing audience and I want to know, well, gee, I have back pain, can a chiropractor help me? Is it appropriate to see one? I think everybody gets back or neck pain in their lifetime. This is very common, and at 80% of us will lose some time from work during the course of our lifetime due to lower back pain. So this is common. But if the pain isn't getting better in about 3 days or so, if you hurt yourself and 3 days later it's just as bad as it was and it's not getting any better, chances are you've done more than simply strain a muscle. There's probably something else involved, and it probably would involve something involving the joint, I would guess. So that's kind of my rule rule, it's a 3-day thing. If you hurt your back, it's better in 3 days, forget it. You don't need to see me. If it's getting worse or it's not getting any better after that time, and you're using heat or ice on it, you always want to use ice first, right?
Okay.
Then I think it's probably appropriate to get it evaluated. Certainly if there's leg pain, and for the example of the lower back.
That radiating pain.
Radiating pain in your buttock or legs, yeah, you really want to get that checked out. That could be something a lot more serious. Or the same thing in the neck. If you're having numbness or pain or tingling into your arm or your hand, again, that's probably something that should be evaluated fairly quickly.
Okay. What you mentioned it just a second ago, you were talking about using ice first. Now, when I see people as a massage therapist, and you go into people and they always want heat.
Right.
And we know it's not effective. What do you say to somebody?
Yeah, well, generally we say that ice should be used in the first 48 to 72 hours after an injury.
That's 2 to 3 days.
That's 2 to 3 days, exactly. And a lot of people, it's so common to hurt yourself and run in and want to lay on the heating pad right away. And even though it feels good at the time, in the long run, you're going to make yourself worse, because what does that heat do? It brings blood. And what is blood? It brings fluid. And what is fluid doing? Well, it's creating more pressure around the nerve, and you're going to have more pain and stiffness afterwards. So you always want to ice the first 2 or 3 days. After that, usually the inflammation's down, and you can go to some heat, because heat brings blood back into the area to help heal it and carries nutrition, of course. I also like to use an alternating heat-cold combination after the acute phase is over. So you can heat them for 20 minutes and then ice it down for 10 minutes after that, and I think that helps too.
So like priming a motor.
Yeah,
Get blood to it and away from it.
That's it. You bring blood in, then you pull the fluid out with the ice.
Cool.
Yeah, exactly.
All right, that's great. Let's get into something that's a little more appropriate, I guess, right now. And we got sports seasons coming up. Football's coming. We know we're going to have some teams doing 2-a-day practices. Some even do 3-a-day. What about stretching? Can a chiropractor tell somebody how to stretch and this kind of stuff?
Oh yeah, we're really big on that. That's a big part of my practice. Is I not only want to fix my patients, I want to teach them what they can do so that this thing has less of a tendency to reoccur again and come back.
Prevention.
And stretching is a really important part of this whole regimen with backs and neck pain. So what the medicine tree is doing now is we're offering to come into the schools and teach the different sports teams a few real basic stretches that are very specific for their sport. Last week I went to Mission High School and I talked to the girls basketball team there, and we did some stretching and I showed them some stuff. And I think this is really valuable. It's better to prevent an injury than it is to treat an injury. And we know that if you have a warm-up period, a stretching period before you put a load on a muscle, it does better. It doesn't tend to tear as readily. So I think you're right. Prevention's the key here, and certainly warming up before an activity is a good idea. One of the things I wanted to say is that a lot of people think they have to stretch right up until the time they participate in the sport. And that really isn't true. We've done some studies and found out that if you stretch well, that stretch will last for at least 90 minutes.
Really?
So if you want to stretch at home before you show up to school and get suited up for your game or whatever, that's okay as long as not more than 90 minutes go by.
What about, we'll go back to football. Well, we can do in girls basketball. A kid has a bad back, they're having some pain, discomfort, they're in spasm slightly, but they're able to play. They get out, they get warmed up, they're playing, they come off, now they're on the bench, they're on the sidelines. What should they do?
Yeah. Well, if they're having spasms, usually, again, that's something we want to use ice with. Sometimes heat feels good, but what I worry about with the heat is that extra blood flow that comes in there. And then when they're immobile, when they're sitting, that blood just sort of pools in there, and then it causes more swelling, and then they're a lot more stiff after. So while you're active, it's better to kind of ice things on the sidelines, and then at the end of the game, it can be evaluated, and perhaps heat would be appropriate at some point during that time, but usually we're talking ice.
So anybody out there listening, like I said, if they have an injury and they are trying to play through the injury, to use ice during the game
I would say
while they're on the sideline.
I'd say that's a great rule of thumb.
Well, and it's a good valuable something for somebody to listen to.
Right.
Because I used to be an athlete a long time ago, and I remember injuries.
Oh, I do too.
And they used to put heat on us.
Yeah, they did.
Always were stiff.
Yeah.
It was really tough. What about sports physicals? I mean, those are big right now. I mean, everybody's got to get them so that they can play by law.
Right.
And are they offering those at your clinic? Or?
Yeah, well, in fact, we're doing something we call a super sports physical, which
Super sports physical.
which is a big
super
sports
athletes,
physical.
right?
Super athletes. Yeah.
Cool.
And what that means is we're doing a lot more than I think you'd normally get in a physical, and we're keeping the price really low so people can afford it. But what we do at the medicine tree is you'll come in, you'll get examined by a medical practitioner, and they'll do a little exam on you, check you out. Then I see the patient, and I'll check their spine, and I'll feel around and see if I find any potential problems in there. And then usually the physical therapist will discuss stretching with them. They'll check for flexibility, that kind of thing. So we sort of have a real three-tiered approach, and I think we do a pretty good job of covering most of the bases during that time. And then we'll give a little report to the individual at the end of the exam, and we'll tell them what we think. We'll give them some stretches to work on certain tight areas. If I find something wrong in the spine, I'll let them know that, give them some ideas on how to prevent that thing from becoming injured. And it's just a real good information type of thing that also gives them a very good physical evaluation.
All right. Hit sports pretty well. Now let's do something else. What about in the workplace? You know, we get work injuries all the time, and you know, the new thing in the world is ergonomics.
Sure.
And so you come in, you evaluate somebody, their posture, where they're sitting, where the computer screen sits. How does chiropractic help that?
Well, we can go into businesses and we can watch the way people work. And we can watch how they sit and how they use a computer, and if they use a headset or a phone. Some people sit like this all day on the phone. They wonder why their neck hurts. So we're able to do that and then give the employer a written report of what we find and a set of recommendations so that, for example, people that answer phones all day, receptionists, I'm a very big believer in headsets. I don't think there's any reason in the world at all, especially as busy as a lot of us are today, to be, you know, sitting like this for a long period of time. This is very hard on your neck.
My wife needs one.
Probably does. And this frees up both your hands, right? So you can be doing things while you're talking on the phone. I think you're more productive. And I also think you have less on-the-job strains and injuries because you're not doing postural things that irritate your spine. So there's things like that. We can go in and watch how they have their chair set. Maybe their chair's too high for their workstation. So they're chronically straining their back or their neck. And I actually have a little program that I can give called Sitting on the Job. It's a slide series, and it shows people, you know, correct ways of sitting, incorrect ways of sitting. We talk a lot about placement of your workstation, so that how far away your screen should be from your eye, the height it should be, the angle of your arm to the keyboard, what the angle should be. A lot of these things make a big difference.
Pretty scientifically studied, huh?
Yeah, ergonomics is a very important thing now in preventative medicine, because if you can fix a patient's problem by just adjusting their workstation, you don't have to treat them, and that saves money.
Now, is workman comp getting behind this type of thing, or?
Yeah, not as much as I'd like to see. I'd really like to see work comp actually have an ergonomics unit funded by work comp dollars, so that these people could go in and for a very minimal fee for the employer offer some suggestions and advice on how to prevent these kinds of on-the-job injuries. But that's prevention, and we're always a little bit behind the times when it comes to prevention.
Well, it's hard to prove prevention.
It is. You don't have all the numbers that you'd like to. But I think if you institute a program like this, over a period of time, you can say, yes, we've had a 40% decrease in back injuries, or whatever you're talking about. So there are ways of measuring this, but it takes time to show that. You have to have a couple years to go by and see.
Right. Well, you got to have the database, and,
Yeah.
you know, clinical studies, and
Right.
all this wonderful stuff. And so going with the ergonomics, is that going to be sort of a wave of the future? Do you think it's going to get stronger?
I think so. It's been around for a little while now, and right now we're in a time in healthcare when you can't do anything unless you can prove that you have outcome data. If you can't prove that what you're doing is helpful, then you're really in trouble with the insurance company, because they don't want to pay for stuff that they don't think helps people.
Right.
And so you got to have the data to show that what you're doing actually works for people. But I do think ergonomics, as more studies have been done, have data coming out now that shows that this is effective.
Well, dollars are tight, you know, and so people are looking at that. So if someone's watching this who's a business person, and they decided they wanted to, you know, have somebody come in and evaluate, we know you can do it. Can other chiropractors in the Valley do the same thing, do you think?
I would think so. I can't speak for everyone else here, but I would think that their training would make them very successful at making some recommendations for people. We know what kinds of postures and stresses can aggravate muscles and joints in the back, and if we can eliminate those kinds of things, then that should make a big difference. So yeah.
Okay, now how do you work with a physical therapist? I know you work with Donna Cambridge up at your clinic. How do you guys mesh together? Well,
Donna may have a patient that she's working with that just isn't coming together as much as she'd like, and she might have me come in and look at them and maybe adjust them. I have patients that I like to give maybe very specific rehab procedures to, or therapeutic exercises that go beyond what my normal training is, and I usually send them to Donna. Some people think PTs and chiropractors are at opposite ends of the spectrum. We're competing, but I think we're a lot closer than a lot of people think. We do manipulation, they generally don't, but they have a lot more skills, I think, in rehabbing soft tissue injuries than we do. So the combination together can be very beneficial for the patient.
Well, because if you look at it, the soft tissue supports the skeletal structure, and the skeletal structure supports the soft tissue.
Yeah, they're all linked together, so it's kind of hard to separate one from the other.
Chicken or the egg, right?
That's it.
Which came first?
That's it.
All right. So what else do you see in the future in your clinic that you see as a hope?
As a hope for people? Well, I think I really hope that the general medical community, the traditional medical community, who really have about 95% of all the healthcare delivery in this country is delivered by traditional medicine. And I really hope that they open their minds a little bit to the possibilities that things like chiropractic and acupuncture and homeopathy and nutrition and things like this can do for people, because these are, most conditions that take people to their doctor's office are not life-threatening. They're chronic diseases, and medicine doesn't have a lot to help with chronic disease. They can kill pain maybe, but they can't always fix the cause of the problem. And sometimes chiropractic manipulation or acupuncture or nutrition can fix the real cause of the problem. And so it seems to me like you want to fix causes and not just treat symptoms.
The symptoms, that's right. So now, where do you see yourself in another year up at the clinic?
Well, I hope that things get bigger and better at the Medicine Tree, and that we're trying new protocols all the time. And we're really, what I hope that is the doctors are beginning to even work even more with each other. I think we're doing that now, and it's been great, but I think there's room even for more improvement there too.
Well, you know, as I sit back and sort of in a foreign area, and I look at where our chiropractors are, I look where MDs are, acupuncturists, and as I see more and more database, I see all of a sudden it's starting to smooth over more and more. You see that in the future?
Yeah, I think we're finding that we're maybe not quite as different as we all thought. We have a different approach, but we all want the patient to get well, right? I mean, this is what we are. We're healers. We're trying to get these people better. So I want to learn what I can do really well and what I don't do so well. And what I don't do so well, I want to get them over to somebody who does that better than me. And I would hope that these other practitioners feel the same way. And what's driving it now is not the consumer.
Right.
It's the insurance companies, because they pay for what they pay for, and they're interested in good outcome studies. And if you can prove that you can help these people at a reasonable cost and get them back to work quickly, they're going to let you have it.
They're going to do it.
Yeah.
Well, Chris, I want to thank you for coming aboard today.
Thanks, Larry. Appreciate it.
And I have one last question, and I don't know if you can answer this one for me or to not while we're still on the air, because we're just running out of time. Do you do your own ponytail or not? Chris, I want to thank you very much for being my guest today. And people, thank you for watching us, and we'll see you next week. Thank you. Goodbye.
Good Medicine is your program. We hope you watch this and subsequent programs to stay informed about your health care. And we'd like to hear from you about how we're doing. Please direct any comments or suggestions you have to us. You can reach us at